Hi, my name is Stephanie Hertz, Director of Marketing here at Forest. Forest is the premier sponsor of the Lifelong Learning Society, and we welcome you to the Riverside Lecture Series. Today, I have the pleasure of introducing Dr. Samantha Smith. Dr. Samantha Smith is a board-certified primary care physician with a passion for holistic treatment and preventative care. Dr. Smith completed her undergraduate school at Boston University and earned her master's degree from Virginia's Hampton University. She studied medicine at West Virginia School of Osteopathic Medicine in Lewisburg, earning her doctorate of osteopathic medicine before returning to Virginia for her internal medicine residency at Lewis Gale Montgomery Hospital in Blacksburg. During graduate school, Dr. Smith gained experience treating patients as an emergency medical technician. She devoted herself to research during medical school and residency, delivering presentations ranging in topics from dermatology to cardiology. She remains active in several medical associations and societies. Dr. Smith entered the field of primary care to treat a diverse range of patients and for the opportunity to help them manage acute, chronic, and complex illnesses. She believes in a kind, holistic, and thorough approach to care and in the importance of clear communication in the doctor-patient partnership. Her areas of interest include preventative medicine and sleep medicine. Originally from the Bahamas, Dr. Smith spent most of her childhood in Newport News, Virginia. She enjoys being back in the region and the endless opportunities to explore, from historic sites like Colonial Williamsburg to the many hiking and biking trails, as well as its proximity to the beach, mountains, and Washington, D.C. She also enjoys cooking and engaging in a range of community activities, from hiking and charity runs to live music and trivia. Please welcome Dr. Samantha Smith as she speaks about sleep medicine, interventions to improve sleep durations in adults.
Right, so I'm Dr. Smith. I'm hailing from Riverside Primary Care, right down the road on Warwick. I'm at the Hydenwood location. With all of that background information, this is really my home away from home. I grew up right down the road from here. I have to say, I haven't been in this room before, so this was a first over a couple decades even. So I'm very excited to be here to speak with you all today. I wanted to talk about a topic that is important for everyone. Doesn't matter how old you are, doesn't matter where you're coming from. This is something that applies to everyone. And hopefully you learn maybe a fun fact or two to take home and share with friends, family, loved ones, neighbors, really just anyone. I don't have any financial disclosures today. I'm not being paid by any sleep medicine specialist or anything like that to be here. So today we're going to learn about sleep. What are the cycles? What is the function of sleep? Is it important? Also, why is it important? What's the connection between sleep quality and your health? Last but not least, I'm going to talk about some interventions, specifically sleep hygiene. But first, just some fun facts before we get started. So we spend about a third of our lifetime sleeping. It might be a little bit less depending on how much late night television you watch, but on average, human beings spend about a third of their life sleeping. Compared to other animals, cats, 2/3 of their life, we see them sleeping, taking naps, all that sort of thing most of the day. Koalas and bats sleep most of the day. So compared to some of the other mammals out there, we don't sleep quite as much, but still a good bit of our lifetime. Of course, newborn babies, we say, sleep like a baby. Supposedly sleep 14 to 17 hours, but if you ask a new mom, she's not going to agree with that number. Of course, with teenagers, a little bit more, and then as adults, we'll get to those numbers. Now, another interesting fact, not too much of a problem out here, but out in Colorado, maybe out in the Alps there, high altitudes actually can change your sleep. So if you've ever thought when you're traveling, if you're a bit higher up than this area or out west, I'm not really sleeping quite as well, even though I'm active and I have all this great fresh air. There actually are studies that show that being at a higher altitude does change the quality of sleep that you're getting. So Do we really need sleep? We do it, but how important is it actually? Usually sleep is the first thing to go. You say, oh, okay, I'm gonna go to bed, get a good solid 8 hours of sleep every night, fantastic. And then life happens, work, school, social events, those kinds of things. And so we kind of cut down on our sleep, whether it's going to bed later, waking up earlier, or both. It's a luxury. You say, oh my goodness, I got to sleep in over the weekend. This is fantastic. That's like a mini vacation. And we don't really stop to think, how is that impacting my health for the long term? How often am I staying up later and later, getting up earlier and earlier to try to fit everything else into the 24-hour day? And how is that really affecting my health? We'll talk about that some more. So I wanted to start with just a breakdown of sleep patterns and really just looking at the cycles of sleep. It's not just we're awake and then we're asleep, unless you have narcolepsy, in which case that's a whole nother story. For most of us, we go through some cycles before you're in that deep sleep where you're dreaming and thinking about Thanksgiving dinner and that sort of thing. So we have two parts: REM sleep, rapid eye movement, and non-REM sleep. Now, the non-REM sleep stages, 1, 2, and 3. Up until about 12 years ago, there were actually 4 stages of non-REM sleep. I'm not going to quiz you on them, it's okay. Now they actually combine those 3rd and 4th stages, so there are 3 stages of that non-REM sleep. Now, when you're awake, getting ready to go to bed or take a nap, you go into that first stage, non-REM. So from stage 1 to stage 2 to stage 3, and I'll talk about those each a little bit more in detail. After stage 3, you get into that nice deep REM sleep, rapid eye movement, dreaming, and thinking about all of those great things. That's when you have those twitches, and sometimes even that's when people start to sleepwalk and those kinds of things, talking in their sleep. So stage 1 of that non-REM sleep is really when you're just starting to think about being rested, just closing your eyes. It's a few minutes, you're still awake, you're not sleeping yet. So it doesn't take much, maybe the doorbell, a dog barking, down the street, something like that. Just light disturbances will wake you up from that stage. But your brain is starting to get into that restful mode. Muscles are relaxing, your heart rate's coming down a little bit, breathing a little bit more slowly. This is about 4 to 5% of your sleep cycle. Stage 2 of that non-REM sleep is when you're actually spending the majority of your time when you're asleep. Now, it's the lightest stage of actual sleep. Stage 1 was just that kind of starting to wind down, get the brain primed to fall asleep. Stage 2 is when you're actually sleeping. Of course, your heartbeat, everything's slowing down a little bit more because you're resting, body temperature comes down, there's no rapid eye movement. So if you were to see somebody taking a nap on the couch and they were in this stage 2 of non-REM sleep, you're not going to see their eyes going back and forth underneath their eyelids or see any of those kind of jerks that people do when they're falling asleep. About 55% of the sleep cycle is spent in this light sleep stage. Stage 3, this is the last stage before you get into that deep rapid eye movement rest. So it's hard to wake people up. This is that really, really deep slumber. It's after Thanksgiving dinner, someone's sitting on the couch, you walk by them, you rattle some pots and pans, try to give them the hint, wake up and come help me with this stuff. You're perhaps taking a nap elsewhere or just in bed. You are in deep, deep sleep. This is very, very important. The body is relaxed. This is when your body is actually having the time to rest, recover, repair from the day. Tissue repair and growth. Cells are regenerating, everything that the body needs to do to get ready for the next day. Also important because this is when some of those hormones are released that help our body function appropriately. And I'll talk a lot more about those as well. Now, about 15 to 20% of our sleep cycle is spent during stage 3 of this non-REM sleep. REM sleep, stage R, no numbers here. There's just one stage or one of the REM cycle. You're dreaming. We have phasic and tonic. So you have rapid eye movements and you have parts where you're not having those rapid eye movements, but you're still having that very deep sleep. Muscles are paralyzed, so you're not running around in the bed usually. And at this time, you're going to notice heart rates actually coming up, your breathing rate might increase, you're dreaming, everything's going on kind of in your brain, if you would, but of course, you're not actually acting those things out. Now, when you fall asleep and you're going through these cycles from stage 1, 2, 3 into REM, it's a cyclical kind of process. So it's not that from 9 p.m. to 10 p.m. you're in stage 1, and then stage 2 from 10 to 11:30 or so on and so forth. These cycles actually last between 60 and 90 minutes in most people. So you're going through this process throughout the night with some periods of interruptions. So just kind of basically, why are we sleeping? Kind of hinted, okay, we need tissue repair and cellular regeneration and those kinds of things to keep us going. But broadly, we're looking at the healing process. So that's the time when our body is not just regenerating cells, but actually reducing some of the toxins that build up just from cellular metabolism, from our body's normal daily functions. Oxidative stress is reduced during this time. And these are the things that actually translate into helping us think more clearly, to critical things, to handle our emotions better, those kinds of things. We also see a boost in our antibody production with good restful sleep. So that's boosting your immune system. That helps you have a better response to vaccinations, helps your body just fight off sickness, whether it's the cold or worse, on a regular basis. And overall, all of these things come together to help help our body fight off chronic diseases. Now, when I mentioned those hormones, we're talking about balance. I'm not talking about, bodybuilders and getting pumped and those kinds of things. Most of us are not having that go on at nighttime. We're not going to bed and waking up the next day ready to lift cars and those kinds of things. Lots of other hormones. And they're very important in all parts of our daily life and health. I'll talk about ghrelin and leptin. Insulin, that's one that we hear about a lot with blood sugar and diabetes, but we don't really talk about, okay, why is it so important that we get that or that we have that in our body? Now, just with that preview, do we need sleep? Okay, good. I was going to say there's a Starbucks right around the corner. If we don't need sleep, we can just get coffee and that's the end of the lecture, but please don't leave. So what is good sleep? Takes quantity and quality. Most adults need 7 to 8 hours per 24 hours. So we're looking at least 7 hours, ideally 8. Now, the quality of the sleep is important too. Lying in bed for 7 hours and watching television for 6.5 of those hours is not the same. We want to make sure that while you are in bed, while you are sleeping, you're not waking up every 30 or 40 minutes to run to the bathroom, or you're not having an alarm clock going off in the background, or the television with an action movie and fireworks and stuff like that going off, and that's keeping you awake or keeping you from getting into that deep restful REM stage. So the quality of that sleep is also very, very important, so you are waking up feeling refreshed. How do we get this good sleep? Well, it's controlled a couple different ways in our body. So we have homeostasis, and that's our body's internal system to keep things kind of regulated. We also have a circadian rhythm that our body wants to follow. So the homeostasis process, automatic. You don't have to wake up and think, okay, keep breathing, keep your temperature down. Okay, what else? Keep your heart beating, all of these kinds of things. This is automatic. This is autopilot. Automatically, the more we stay awake, the more our body craves sleep. Now, here I have the more people stay awake, the more they sleep. Not always the case in real life. Circadian process is from an internal sort of pacemaker. So we're looking at the diurnal pattern, so daytime, nighttime, and our circadian rhythm ties in with that. So how does that play into kind of the nitty gritty, those little details about hormones? Well, these interactions are quite complex with neurotransmitters and the neurons that are connected and lots of different hormones and other chemicals that our body produces, and some that we also supplement or drink, perhaps, like I said, from a coffee shop down the road. However, everyone's sleep-wake cycle is following this basic circadian rhythm. Approximately every 24.25 hours, if you like to read NASA's information, it's 24 hours and a quarter, but 24 hours, we'll say, we are synchronized with the nighttime, daytime routine. Our body wants to enter that period of rest, followed by a waking period. So let's walk through a typical day of what's going on with our body with that sleep-wake cycle. We wake up maybe around 6 or 7 a.m., sun shining in, or we flip on the light. Our retinas say, okay, our eyeballs sense, oh gosh, okay, there's that light, time to go. Our suprachiasmatic nucleus, I won't quiz anybody, I promise, on that word, says, okay, turn down the melatonin. It's time to get going. It's time to be alert. That sunlight and actually other wavelengths of light tell our body literally time to get up, time to be alert. After that, we have some different hormones that kind of spike throughout the day. Now, here we're looking at some adiponectin and insulin, some growth hormones, those kinds of things that are later on in the evening. But I want to draw your attention to a couple key hormones that I'm going to talk about some more. Mainly, if you look around 6 a.m., maybe a little bit after 7 a.m., you see the cortisol. Just before 6 or at 6, we see testosterone, some thyroid hormones, prolactin and leptin, which is not too far after midnight. Now, those are all essential, and there are many, many, many more. But since we're not doing an endocrinology presentation today, we're going to focus on the key hormones that help regulate our health and prevent those long-term health conditions. So coming back just to those key hormones, we're looking at that cortisol level, the adiponectin, the leptin, and I'll talk about each of those a little bit more. But just to simplify, some are high during the day, some are low during the day. This is one of those other kind of pictures just to tell you a little bit more about how complex it is and how many other factors there are involved. But when we start throwing in all of those nitty-gritty details, it kind of just draws away from really the big picture of what's going on there. So, ghrelin and leptin. These hormones have been studied for years, but leptin actually wasn't published or spoken about significantly until 1999. We knew it was there, but we didn't know really what it was doing or what its exact role was. This has been in the papers and kind of been published a lot more about recently because of the information that's coming out about its effect on appetite regulation, as well as ghrelin, kind of its counterpart, if you would. These two hormones kind of work together as sort of partners to have opposite effects on our appetite, and they're stimulated through our sleep-wake cycle. Now, that first one, that ghrelin, actually stimulates a part of our brain to increase our desire and ability to eat. Now, when we're sleeping, we shouldn't be eating. Melatonin, which you might hear about those supplements to help with sleep, that's a natural hormone as well, but that actually decreases ghrelin. So when you have those higher levels of melatonin, when you're getting that restful sleep, your ghrelin levels should be pretty normal, not spiking, not stimulating that appetite. Now, what's the opposite of that? You're not getting that rest. Something's going on with those ghrelin levels. You feel hungrier. Now, leptin is kind of the opposite. That one is actually increasing during the day. Now, it actually does stimulate some of that satiety, some of that feeling of fullness when you eat. We don't really have low levels of this unless you have a deficiency, which is very, very rare. So it's not something that we can say, oh, just take a pill and we'll just keep increasing that leptin level and then we'll never be hungry. It helps with satiety. It helps with feeling full, but doesn't quite work that way. Not quite an easy fix. I'll talk about that a bit more as well. Now, this was just published a few weeks ago, October 18th. This is actually based on a study that came out in the UK, and they did a meta-analysis. They looked back at a study from 1984, the Whitehall study, and they said, okay, they're looking at sleep patterns and obesity and just some chronic health conditions. But this was really the beginning, just before we had all of that information about leptin and ghrelin and those specific hormones. And what they found at this time was really, okay, looking back at that old study, bringing it forward to many, many other studies, and now the information that we know about ghrelin and leptin, we can see, yes, there is a direct correlation between these hormone levels and actually being overweight to an unhealthy point. We can actually look at those levels and determine, okay, if they're this low throughout the day, or if we help encourage those levels to be a little bit higher, not a magic pill, mind you, but encourage them to be higher through habits like better sleep, then we do actually see a reduced body mass or a healthier weight. So what they did, they looked at several thousand people and they said, okay, how many hours of sleep? They had a control group and of course the study group. And they were looking at people ages 50 and older. So it broke it down to the groups of people that were sleeping 5 hours, 6 hours, 7 hours, 8 hours. And they noticed a very, very clear correlation between sleep duration and body mass index. Now, the body mass index is a number that we use to determine how healthy you are. It's just kind of an average. Doesn't take into account muscle mass and those kinds of things, but we're looking at the height and the weight of the average adult and really where a healthy range is. So they noticed that there is a pretty strong correlation between lower sleep duration and that higher body mass. Short sleep periods were associated with the low leptins and, of course, higher ghrelin. Now, they also looked at these numbers and the sleep periods with polysomnography. So they were taking into account not just the quantity of sleep, but that quality, that second part of the sleep process, by using a sleep study equipment that's called a polysomnography. Now, with all of this research, they said, okay, we know for sure people that are getting this amount of sleep, at least 8 hours, are seeing better levels, higher levels of leptin, and lower levels of the ghrelin. Conversely, shorter sleep duration or sleep quality ended up causing reduced leptin levels and that higher ghrelin. So what that translates into in English is, okay, you're feeling hungrier and you're not feeling full when you are eating. You're sleeping less. Now, another fun hormone, cortisol, the stress hormone. This is your fight or flight kind of hormone. Let's go, let's run, okay, or let's sit in traffic and hope that that light turns and everyone stops when they're supposed to. That's fight or flight. This hormone starts to rise about 2 to 3 hours, actually after you go to sleep, and then again in the morning. Cortisol follows that circadian rhythm as well. It peaks around 9 o'clock in the morning. So if you have a meeting planned, a breakfast, something like that, just keep in mind, it's okay, take a deep breath. It's 9 a.m. in the morning, your cortisol level is peaking, it's going to start to go back down, hopefully. As the day continues, that level should start to come back down. And then, of course, it does go down during sleep. Now, cortisol plays a major part, not just in the fight or flight regulation, kind of that process, but also with regulating glucose or blood sugar levels, as well as fat metabolism, lipids, and sensitivity to insulin. Insulin helps our body use the glucose, use that sugar that's in our blood from our food and nutrients to actually have the energy to do what we need to do every day. It also has some anti-inflammatory and anti-fibrotic, or it helps with some scar tissue reduction and antioxidant effects when it's working as it should, or when it's at the levels that it should be. However, insomnia, sleep deprivation, you guessed it, they affect your cortisol levels, actually causing it to secrete more of that level at cortisone. Instead of that level starting to decrease, our body actually has this built-in signal, this indicator. It says, we need to stay alert. If you're staying awake longer and longer throughout the day, there's a reason for it. We need that alertness. So our body will actually send off these little bursts of cortisol throughout the day, which is going to keep you alert if you're on a long drive, sitting in traffic or something like that. But over the long term, having those extra bursts of cortisol for longer and longer in periods does have some effects on the body. Now, melatonin, this is the good one. The one they say, oh, it's over the counter. That one comes in a tablet. It always sounds great. Everything that comes in a tablet doesn't have too many side effects. We think it's natural. Our body makes it. Yes, absolutely. Melatonin actually plays a major, major role in that circadian rhythm, particularly in sleep onset and maintenance. Now, melatonin is not a magic sedative. It is something that helps with the onset of sleep, getting into that restful, we're thinking N2 stage of the non-REM sleep, but also maintaining that sleep. So it's not a magic pill, but if you are taking that supplement, that's how it's supposed to help by boosting your body's natural hormonal response there. Now, although the melatonin levels do actually decline as we gain more birthdays, it doesn't completely go away. It's not something that we turn a certain age or have a certain number of candles on the cake and then we have no melatonin. But we do know that with time that hormone does decrease. And if you think about it, sort of in the big picture, thinking back to that first slide about how much sleep babies need and then teenagers and adults, sort of makes some sense there. You can tie that in. Now, estrogen, another hormone that we think about with aging process and just really throughout our lives. This actually helps indirectly by playing a role with the metabolism of serotonin. Serotonin is a chemical that is associated with some mood disorders if it's imbalanced, depression, anxiety. So it's really important to have the appropriate levels of estrogen so that that serotonin can also be used by our brain or body in the appropriate way. Estrogen also helps our body temperature stay a little bit lower at nighttime, which is more conducive to restful, that good quality sleep. Because of the way that it plays, that works with the metabolism of serotonin and have some antidepressant effects as well. And there are actually studies that have been shown that estrogen replacement therapy during menopause can help with some of the vasomotor symptoms and also help with the sleepiness, the insomnia that many women do experience during that menopausal period when those estrogen levels are changing and decreasing. Now, testosterone, this one's a little bit more kind of abstract. It's sort of not quite the chicken or the egg, which they just published something that said the egg came first, by the way, but testosterone, we know that it does play a part in sleep. Now, it doesn't break down another hormone or quite have a role like estrogen does with serotonin and those kinds of things. But we do know that when you're not getting enough sleep, your body is not producing enough of that testosterone. So I kind of have this back and forth, low testosterone due to poor sleep. But if you also are getting poor sleep, then that's decreasing your testosterone levels. This affects men and women. Men also obviously have testosterone. Women do also have some of this hormone. And so this is something that is being studied currently to see what else can we do? Is this something that we can use, perhaps in a way like estrogen replacement therapy to treat some of the symptoms, the insomnia that we see with menopause? But there hasn't been anything quite definitive just yet showing that testosterone replacement helps with sleep or insomnia at this time. Now those thyroid hormones, we think, oh gosh, hypothyroidism, my thyroid is underactive. I'm just tired and fatigued. Now, yes, that absolutely is going to make you feel like you need to sleep more. If you're tired, you want to sleep more. However, we also want to look at the other side of things. When your thyroid is overactive or hyperthyroid, that's going to increase your heart rate. It's going to increase feelings of anxiety. You're going to have trouble falling asleep and staying asleep. Actually shown that people with lower thyroid hormone levels, even we say subclinical, which means, oh, okay, that number, from the lab, from that blood work that your doctor drew a couple weeks ago, oh, it's just barely low, but you're having some of these symptoms, does actually cause you to have longer sleep latency. It takes longer to fall asleep. You're not sleeping as much as you can, even though you have the time to do so. And you're just not feeling rested, just lower satisfaction with that sleep quality. Downstream, with that hypothyroidism, that underactive thyroid, we do tend to see not just the decreased metabolism, but also weight gain, which can cause things like sleep apnea, and it puts a lot of extra pressure and stress on the body at nighttime. So, kind of changing gears for a moment, we know what our body is making. What about things that we're putting into our body that affect our sleep? Nutrition. Tryptophan is we kind of think of that as the food coma, the sleepy time sort of chemical, or the amino acid. This is found in turkey, cheese, egg whites, fish, milk. If you ever grew up hearing, okay, if you can't sleep, have a glass of warm milk before bedtime, it's going to help you sleep. Or after a big meal, you feel like, oh gosh, it's time to sit back and unbutton your pants and take a nap, just rest. Tryptophan actually does help our body make serotonin. So this actually does help you feel sleepy or help you get into that restful state. Now that serotonin also helps with that melatonin. So you're starting to see that pattern where all of these these hormones are connected. Now, what about the not so rest and digest, but caffeine? #1 drug used in the world. And yes, it does fall under the category of a drug. It's not illegal, but this does actually cause a significant amount of stimulation. Now, I'm talking about a half-life up here. So we get up in the morning, maybe have a cup of coffee, maybe a cup of tea, mid-afternoon, around 2 or 3 o'clock, another cup of tea or coffee, just to keep going. After 6 hours, only half of the amount of caffeine that you drank is out of your body, has been broken down. So even though you might not feel as awake as you did after that first couple ounces or that first sip of coffee, that first cup in the morning, when you add on another cup later on in the day, and maybe another cup around 4 or 5 o'clock, all of that caffeine has an additive effect and it's building up. Keeping in mind that it takes 6 hours for half of that amount of the caffeine to get out of your system. So if you had a cup of coffee, let's say, think about it like an 8-ounce cup of coffee at 4 o'clock, about the equivalent of 4 ounces of that coffee are still going to be in your system 6 hours later. So think about that when it's time to wind down and get into that restful state. Alcohol. I'm talking about a nightcap, not rubbing alcohol, but a plain old nightcap. We call it nightcap. Time to go wind down and relax after a long, stressful day. Not so much. You might fall asleep, but you're not getting that good, deep, restful sleep. Alcohol actually blocks the body from going through those cycles, the non-REM into the REM stage naturally. So we think, oh yeah, okay, you have a glass of wine and then I'll go to bed. Okay, once in a while, but it's not helping you get that good, restful, quality, refreshing sleep that our body needs to regenerate and repair. Another stimulant that we don't necessarily consider a stimulant, but nicotine. So think cigarettes, chew tobacco, pipe, that is actually a stimulant. Now, after it doesn't last in your body, the stimulant effect, as long as caffeine, but that is something to keep in mind, that is still stimulating your body, still is working on those receptors on your cells to stay alert. Decongestants. It's this time of the year, everyone's using the nasal sprays or cough syrup, cough medications. Those are also stimulants. And the opposite, allergy medications, Claritin, Allegra, Zylol. Sometimes you say you need to take it at night because that's going to make you very, very sleepy. We don't want you to take that and then try to go run errands or something like that. Yes, that will make you drowsy, but you're not getting into that deep REM sleep with antihistamines. You might have heard of someone or friends, family members taking Benadryl or Unisom, some over-the-counter kinds of antihistamines that have diphenhydramine in them, which does cause that drowsiness. Yes, you will sleep, but you're not getting that REM sleep. It's not that deep regenerative sleep. So this is kind of just a breakdown of what happens when your circadian rhythm is not in tune. We talked about how important it is to sort of follow that pattern and why, and the effect on those chemicals and what's going on with our body. But in real life, that's not always the case. So it can be work, can be travel schedules, can be all of those good things, the cup of coffee, the nightcap, a big meal, too large of a meal before lying down, all of these sorts of things that are disrupting our body's natural circadian rhythm, misaligned. So over time, we can start to see things like high blood pressure, higher what's called lipid or higher fat levels, and adiposity. Adipose tissue is fat. The big fancy way of saying fatty tissue. With that, we see more inflammation, and that leads to heart disease, affecting not just the heart, but those blood vessels, that high blood pressure. Now, we also notice that the melatonin is not being synthesized. It's not being metabolized in the appropriate way in our body, whether it's not enough because we're not in that restful period enough, or we're not getting enough of those like amino acids like the tryptophan to make the serotonin, to make the melatonin. We're not getting enough of that. Could be due to stress, things like that, anxiety, keeping us up at night. It's messing with that slight sleep-wake cycle. That has actually been shown to lead to things not just like short-term memory, but over the long-term things like long-term memory, increase the risk of dementia, Alzheimer's, and several other neurological diseases. Not to mention the impact that it has overall on your mental health and well-being. Mood disorders, anxiety, depression, just as an umbrella. There are many, many more. But when your body isn't able to go through these cycles and get that deep sleep that's encouraged with melatonin, it really affects the way that we're functioning, not just at work, not just reaction time when driving, but it affects our prefrontal cortex, the front of our brain, the part that helps us make those executive decisions, or maybe when we're a little bit tired, makes us a bit crabby or snappy or irritable. That's where that's coming in. Now, with the far right there, talked about metabolism and those changes. Now, dietary habits and timing, we'll talk a little bit more as well, but that breaks down to how our body is sensing that glucose, that blood sugar, and insulin. So when you're throwing off this circadian rhythm, our body isn't as sensitive to insulin. Insulin is like the gatekeeper for our cells to allow that blood sugar, that glucose to get into the cells, to give us the energy to do everything that we need to do, and for our organs, our body to do everything that it needs to do. So when those levels are off kilter, out of balance, so is your insulin sensitivity, so is your glucose, and we can start to see things like diabetes, high blood sugar problems, blood sugar regulation problems, all of those sort of metabolic syndromes, as well as some stomach problems. And so that can be things, not just plain old acid reflux, but a lot of other digestive issues as well. So, and back to that study a little bit more, I wanted to talk about the exact times, looking at 7 hours, and the 5-hour mark, kind of the opposites of that spectrum there. Looking at the participants in these studies, they saw that if you were sleeping less than 5 hours, we're talking actual sleep, good quality sleep, less than 5 hours, there was a significant increase, 20 to 25% increase with developing a chronic disease. Chronic diseases such as heart disease, high blood pressure, high cholesterol, insulin desensitivity, which can cause high blood sugar and diabetes, sleep apnea, which affects how you're breathing at night. You have these periods of waking up because your brain feels that it's not getting the oxygen that it needs for some reason. Now, they also noticed if you were getting significantly less than that 5 hours, and this is all still at age 50, you did have almost a 20% increased risk of also developing a second chronic condition, comorbidity, multimorbidity. So that's not just high blood pressure on its own, it's high blood pressure and cholesterol, high blood pressure and diabetes, high blood pressure and digestive issues. So multiple kind of chronic conditions. Now, when we talk about here at age 60, that risk goes up. We have some more birthdays. That risk actually goes up to 32%. At 70, we're looking at 40%. That's almost 50%. If you're not getting more than 5 hours, preferably 7 hours of sleep, then you almost have near 50% chance of developing some kind of chronic illness, some kind of chronic disease that needs to be treated. Now, when I'm talking about sleep deprivation and the 5 hours, 6 hours, 7 hours, 8 hours, we have to look at what's the actual difference between insufficient sleep on occasion and just plain out insomnia. Everyone says, oh, I have insomnia, I have insomnia. Well, that could be possible, but what does that really mean? We need to look at the ability to sleep. Do you actually have the time to sleep? Are you taking the time to sleep? Are you going home and having dinner, relaxing, all of those kinds of things, then sitting down, getting ready for bed at a regular hour? Or do you have too many other obligations after work or throughout the day that are preventing you from actually getting to that time to sleep? Now, also the duration. Is it that full time that we ideally have there, or the 6, 7 hours? Or is it just these kind of little, I fall asleep for half an hour and then I wake up every so often and not getting back to sleep, not getting that restful sleep? Now, with insomnia, they're saying even when you have the chance, even when you optimized everything, gosh, you're not having a nightcap, you're not having coffee afternoon, you've looked at all of these different things and you still cannot sleep. That's when we start to say, okay, this is absolutely insomnia, not just insufficient sleep because of those day-to-day kinds of activities and behaviors. Now, talked about those hurdles. We talked about the stimulants and medications, alcohol, those kinds of things. But what about just physicality? Things like women with pregnancy, just discomfort. What about pain? Things like wear and tear in our body from every day, arthritis, having the temperature in our rooms or in our homes to the right setting, just physically what's going on with our bodies or in our environment that can change or affect how you're getting into that restful state. We also look at things like right now, allergy season. Are you so congested that you cannot get comfortable and you're breathing through your mouth and your mouth is dry and that's waking you up? Do you have restless legs, think of restless leg syndrome, where tossing or you feel like it's time to lie down and you're in bed at 8:30 and everything, but your legs feel like they've got a mind of their own. Also, you do see this, the problems with sleep with people that have had injuries to their heads. Actually, that front part, that prefrontal cortex, whether it's car accidents, sports injuries, anything like that. And we also want to look at, talks about those hormones, but physical cues. Daylight, artificial light, how bright are your lights? You have those daytime light bulbs in your bedroom. And so even though you're trying to wind down, but at 9 o'clock, we have the fluorescent lights that you can see from space in the bedroom. Now, I always think about that. They show pictures from the satellite and you can see the East Coast of the United States just brightly lit up around like New York, and then pan over to the West Coast and kind of the middle of the country, big sky country, Montana. It's almost dark. So those fluorescent lights. Now, also things like meals, snacks. Are you snacking right before bed? Are you getting into a routine of, okay, I have a nighttime routine. I brush my teeth, shower, pet the dog, say goodnight to the kid, whatever. Do you have a routine? Or is it, okay, some days I come home and I watch TV for 6 hours and then I scramble to make, a midnight snack or a late dinner, or do I try to go out here and have social obligations here and there, and then there's no real routine, fall asleep on the couch and then maybe move to the bedroom at 2 o'clock or vice versa, those kinds of things. And of course, the really, really big one that we look at is our work schedule. looking at those ages, 50s, 60s, 70s, the work schedule might change, and then that's replaced by hopefully a little bit more free time and flexibility, but we often stay in that same habit of waking up and staying late. I did when we were working, taking care of other family members and those kinds of things. I did another study, actually several studies. I talk about studies a lot, so you know that I'm not just making this stuff up and it didn't come to me in a dream, but we're looking at several countries across the world. So Iran, United States, United Kingdom, Korea, Italy, Sweden. This is something that's been observed everywhere, regardless of things like diet and different aspects of culture. This is looking at the impact of shift work. Now, that's not just working the midnight shift. We're looking at things like people that are like flight attendants, long distance truck drivers, pretty much any kind of job that is preventing you from following all that regular sleep-wake circadian rhythm cycle. Now, when we look at the impact on health, that takes into account the complete physical, emotional, and social wellness of a person. And that's the World Health Organization definition. This is not just illness or an ailment. So in these studies, they were looking at not just, okay, how many people that work the midnight shift develop diabetes, or how many maybe have a higher risk of having a heart attack. They're looking at the health of these individuals. And they did see significant increases in things like the cardiovascular disease. And actually one that I found very interesting was the increased risk of breast cancer in women who worked night shifts. Not something that we think about, but if you start to think back to the estrogen, those hormones, that's where that kind of relationship comes into play. A little bit complicated, a little bit stretched a little bit, but we did actually see there is that connection, not just on the quality, but this really can lead to some different kinds of chronic diseases and even cancer. Some more hurdles. Exercise. Now, don't have to go out and run a marathon, don't have to go out and walk 5 miles a day. But we know that staying active consistently, regularly, does actually reduce those cortisol levels. It reduces that fight, flight, stress level, increases the serotonin level. You might have heard about the runner's high. Now, usually that's more so with those sprinters and the marathoners, but exercise in general, moving your body, does increase the serotonin levels, that feel good hormone that also plays a part in melatonin. With the reduction of cortisol, we can actually see some reduced aches, pains, and inflammation, which are some of those things that are going to keep you up at night. So if we're staying active, lowering that stress hormone, increasing the feel-good hormone, that also helps with the melatonin and sleep hormone, and we're reducing aches and pains from being stiff and sitting all day, all of those things are going to come together to help you get that really good sleep. And of course, stress. Gosh, stress is racing thoughts, ruminations, lying awake at night, trying to solve all of the problems in the next 4 hours before your alarm clock goes off. That's going to keep you up. And I think that that's one that we've all experienced at some point or another for any reason. But that stress, that anxiety at nighttime really does have the opposite effect on that cortisol from the exercise, from being active. That's going to push that cortisol up. That's going to keep your body alert. So as we're ruminating and thinking about that same, gosh, giving that lecture tomorrow morning, we're getting hyped. Our body's getting energized. It's like, okay, we're ready to go. Get that heart rate going. That's not what you need at nighttime. That's not what we need going through our body at bedtime. I started to talk about dementia, mood disorders, emotional changes, our judgment changes, literally. So when I talk about judgment, I'm not talking about sitting in a courtroom, but just on a daily basis, looking at for the risk, taking riskier actions. Oh, can I make it through that yellow light? Or gosh, that risky interaction or the change in judgment can be, am I going to help out with the dishes tonight, or I'm going to sit here and close one eye and pretend that I'm asleep, and that's going to cause some chaos a little bit later in the house. Also, we look at the muscular side there, those aches and pains. If you're not getting that deep sleep, again, that regenerative sleep, increase inflammation, your body doesn't have a chance to get rid of those toxins. Of course, that heart health and the sort of that growth suppression, a little bit younger teenage years when we look at kids that are drinking lots of caffeine and energy drinks, eating a lot of maybe dark chocolate with caffeine does affect, of course, you're awake more, you're not getting those growth hormones. We tend to see actually shorter adults if they were kids and drinking lots of caffeine and having those stimulants. Also, you did notice not just the kind of direct and clear relationships there, but just thinking abstractly. They looked at critical thinking tests, and Harvard does a lot of these clinical trials. I participated in one of them when I was living in Boston in undergrad, and they ask you, okay, how much sleep have you had? And then they ask you to do a puzzle, and they look at that and collect that data, and it's free to read and say, oh, wow, I should get more sleep tonight so I can think better tomorrow. And we add it to the to-do list. But it actually prevents your brain from being able to think abstractly or critically, problem solve. And of course, that's going to lead to perhaps some more anxiety a little bit later. So what can we do about all of that? Really, I like to break it down. ABCs. We need to tackle what's causing anxiety and stress. Now, whether it's restructuring our daily schedule, whether it's kind of tackling something, a problem that's been kind of on the back burner, but it's causing a little bit of irritation and stress kind of just bubbling under the surface. You can talk to somebody, counseling. They have services now on the phone and your computer, and even things like journaling can be helpful. Back to that exercise, reduce those cortisol levels. And even things like stretching, talking to a loved one on the phone, has actually been shown to be helpful in reducing anxiety levels and those cortisol levels. The biologic clock, that circadian rhythm, pay attention to it. It really, really does matter. All the caffeine in the world is not going to change your circadian rhythm. Sometimes people say, oh, I'm a night owl. Fantastic. Still need sleep. And it's still, your body is still going to put you into that sort of sleep-wake cycle. Now, what helps set that clock? It's what time you're getting up every day. The first few hours of light exposure. So whether you're getting up at 4:30 in the morning, let's say for 30 years you had to get up at 4 o'clock in the morning or 4:30 in the morning, turn on the lights, get ready to go to work. Long after retirement, that sleep pattern or that wake pattern is going to stay with you. We're looking at the light exposure. Remember, going into your eyes, telling your brain, time to get up, time to go, time to be alert. And that pattern sticks with us. So yes, the circadian rhythm, but also looking at those kinds of factors, your body temperature as well, and the release of those hormones. So the temperature, if you are turning your thermostat up at night and your body's hot, saying, okay, it's time to, we're staying active, we're staying moving around, you can't get comfortable. We sleep better when it's cooler. Not 28 degrees like it was this morning outside, but we do sleep better when our body temperature is a bit lower. It wants to do that naturally. When you travel, it takes 2 days to readjust your biologic clock for every 1 hour that you change the time at which you wake up. So let's say on a Saturday, on a day off, you oversleep by 3 hours. That's just like you'd flown from Ohio, from Cincinnati to San Francisco. That's the kind of jet lag that your body is going to feel for 6 days. Those 3 hours, like 6 days of jet lag, it's going to take you 6 days, a full week for that 1 day of sleeping later than you usually do to get back into that pattern, which means it's going to be harder to get back to sleep, and then harder to want to wake up at that normal time. Now, of course, we do it, and that's what the alarm clocks are for, but it is more challenging for the body to do so, and you feel more tired, a little bit harder to get into that deep sleep. Now, the conditioning. Oops. So with the brain, psychology, all of this is a lot of conditioning. Conditioning. So we're looking at positive and negative conditioning. We're trying to retrain our brain, trying to trick our brain into doing what's good for it. You need to say, okay, time to go to bed. I'm going to fall asleep. I'm going to have a restful night of sleep. That kind of self-talk is getting you ready as well to actually have a good night's rest. Often you hear insomniacs or people that are not sleeping well, if I can't sleep, I can never sleep. Oh my gosh, I'm not going to sleep tonight. I have 100 things to do tomorrow. I'm thinking about everything. I'm not going to sleep. You need to cut that self-talk out, that negative conditioning out, because our brain's going to believe us. If we say, I'm going to have a terrible night of sleep, I never sleep, I never get rest. Gosh, the longer days during the summer, the sun's up, I don't feel like I need to go to bed. Or shorter days, I don't want to get up in the morning, the sun's there, I'm not going to sleep well, I'm going to oversleep. This kind of negative conditioning of the brain, it works, just like the positive conditioning does. That also works. So we need to remind ourselves to train our brain, condition our brain to think positively about sleep and to approach insufficient sleep or insomnia, sleep deprivation in a more positive way. Now, that last bullet there, drugs and other interventions, what am I talking about there? Well, sometimes you need a bit of assistance. So there are medications out there to help us sleep, to help get into that restful state. Hopefully they're temporary for weeks or months, not something long-term, but those medications do carry risks, as all medications do, of your body becoming more dependent or not taking the time to retrain our brain to naturally get into that restful state. We can become dependent on those kinds of medications, but sometimes they are necessary and they are helpful. Other interventions are to treat things like sleep apnea, a CPAP mask. If you're physiologically, if your body is changed in such a way that perhaps it's cutting off the amount of oxygen that you're getting at nighttime, that's not something that you can retrain your brain to get around. We need a little bit of help. And so we have things like a CPAP mask or oxygen mask or something of that sort to help get that better sleep. Now, just learned about a new implant called the Inspire, and it's actually something that's placed in the back of the throat. It has a little sensor that you kind of wave over it and you go to bed, and instead of wearing a CPAP mask, it actually kind of stimulates those muscles to prevent that flap from going over so that you actually get restful sleep. Very cool stuff, very Star Trek kind of futuristic, but it's here and now, and we actually have sleep medicine and pulmonologists that are doing those procedures here in Newport News. However, I really want to focus on the conditioning part of things. What can you do every day in your daily life? What can we all do to get better sleep? And it's pretty simple. You don't need any fancy gadgets, no surgeries or anything like that. You just need good sleep hygiene. What does that mean? Not talking about showering and brushing your teeth. We're talking about those habits, those healthy habits. Make sure that you give yourself a buffer before bedtime. When you get home, disconnect, try to disconnect from the stress of everything going on the day, whatever it might be, 30 to 60 minutes before bedtime. That's before you get into bed and put your head on the pillow for 30 to 60 minutes. Start to get into a routine that's conditioning, that's training your brain to say, oh, okay, we're getting ready to rest. Let's do this. Screen time. This is my favorite. Stop the screen time. So we think about the television. We fall asleep. Oh, the television's putting me to sleep. No, it's not. You're falling asleep with the television on, but that pesky light is still there. Your eyelids might be closed, but there's still some light getting through those eyelids, and that's still preventing you from getting into that deep sleep. The blue wave light, the wavelength of light, comes from television, comes from laptops, tablets, cell phones, even the Kindle. There's a new Kindle White if you like to read in bed and you're on your Kindle or playing Scrabble in the Kindle. That's still light. It might not be blue light because they changed it and made it a little bit fancier, but it's still light, and that's still going to be stimulating your brain to stay awake. So at least 30 minutes before it's time to get some Z's, no screen time. You can still read a book, a magazine, something like that. You don't want to stimulate your brain to stay alert. Now, here we're talking about the melatonin again. You might say, oh, okay, but I'm taking melatonin and getting into bed, it's not working. Well, if you take the melatonin to help our body with that process, but then we get the phone, you might as well just cancel it out, because literally that light is telling your brain, nope, we need to tone that down. We need to stay alert because of this light. Consistent sleep schedule. Remember that jet lag and sleeping in for 3 hours, and it's going to take you 6 days to get back to your body's routine, for your body to feel like it's ready to be back in that routine and rested and those kinds of things. Go to bed around the same time and try to wake up around the same time every day. Yes, that's weekends. Yes, that's holidays. Same time, as close as possible. That prevents that kind of jet lag sensation that our body feels. Even though you have a day off, you can get up, maybe take a nap a little bit later on and kind of catch up on your sleep that way, or your relaxation that way. But going to bed and getting up at the same time every day, we're conditioning our brain to stay as closely aligned with that circadian rhythm, that sleep-wake cycle as possible. And that's removing one of the largest hurdles of good restful sleep. When you're setting that bedtime, that means, okay, you need to get at least 7 hours. So going to bed at 12 o'clock and waking up at 4 o'clock, great. You have the consistency part. Are you getting the quantity? Not so much. Make your bedroom a sanctuary. You want it to be peaceful, quiet, restful, cool. You don't want the alarm clock with the red light blaring right next to you on the bedside table, or your phone buzzing throughout the night with emails. If you have the radio, we want that turned down, turned off. If you have the television, we don't want that on all night long, because again, that light is still keeping you up. We want to make sure that the bed space is used for the 3 S's. Does anyone have a guess what the 3 S's are? You already know one of them. Sleep? Yes. If you're sick, if you're not feeling well, that's the one I like to throw in there, because we know the 2. We know the 2 S's, sleep and sex. And if you're sick, rest, stay in bed, that's fine. Make it your sanctuary again. Bed is not the place for work and coffee. They have all of these great new lap desks. They even have a whole desk that you can pull across your bed, and you don't have to leave the room. You can control the whole world there from your bed. That's not what it's for. We need to make sure the bed is for sleep, sex, and if you're sick. Okay? Same thing with the caffeine, afternoon or evening. Remember that 6 hours for it to break down. And that screen time, I can't say that enough. Large meals. We always have dinner in the evening, perhaps a snack a little bit later on. When you're eating that larger meal, or even a second snack or a second dinner, that is going to be sitting, it's going to cause your body to try to stay active to digest that food. If you go lie down, instead of gravity helping your body move that food down into your stomach, down throughout your digestive tract, it's going to be sitting right there, and that can cause things like heartburn, acid reflux, over the long, even nausea, just general kind of stomach unease. After that, you're going to be waking up to go to the bathroom. You're not getting that good quality restful sleep. Now, the alcohol and the nightcaps, they say 60 minutes. That's the studied time, at least 60 minutes before bedtime, because I don't imagine everyone's going to go out and say, never going to have a nightcap again. 60 minutes is the time that you would ideally like to wait before you go to lie down to rest. And if you're just not ready to go to sleep that day, get up and do something relaxing, something quiet. Don't get up and do your taxes at midnight, but do get up and do a little bit of activity. Maybe go read a magazine, or just do something around the home, and then go back and lie down, instead of lying there thinking, I should be sleeping. I've been lying down for 45 minutes. I'm not asleep yet. I'm antsy, this and that. Don't put your body through that stress, because we're getting it back into that fight, flight, alertness stage. Get up and do something for a few minutes, and then go back and try again. Now, some additional resources. The National Sleep Foundation, nonprofit, they have a lot of great ideas about restful activities. Things such as, they talk about Tai Chi, walking around the block, but also some free apps like Calm and Headspace, things like even playing board games, just these activities that are not high tech. You don't need any special equipment. You don't even need another person to do it with you all the time, but just activities that help our brain rest, relax, get into that kind of feeling of, okay, we're going to bed now. Of course, the American Academy of Sleep Medicine, one of my favorites. They always are coming out with great new studies, and they're they have a lot of fantastic information, and it's not all just a bunch of jargon. They actually have some really helpful resources as well that you can peruse, some quick 5-minute reads and those kinds of things. And the Centers for Disease Control, the CDC, I think we all know a little bit about that now for the last few years. But aside from all the infectious stuff, they are looking at those chronic health conditions. And we know that sleep impacts all of those chronic health conditions, so they're also a good resource. So in summary, do we need sleep? Is it good for our health? Does it really matter long-term if we're not getting those 7 to 8 hours of sleep every night? Absolutely. Thank you. Now, if anyone has any questions, I'd love to hopefully answer them. If I don't have the answer, then I'll hopefully have a resource for you. Please, I saw your hand first.
Okay. Thank you so much. We have a few questions online. Can the 7 to 8 hours of required sleep be broken up throughout the day?
Yes. So actually, I did read a couple studies looking at, okay, they say 7 hours per 24-hour period. So yes, that has been shown to, if you, let's say, go to bed at a certain time, sleep for 4 hours, or up for a little bit, then go back to sleep for 3 or 4 hours. That is still better than only getting 4 or 5 hours of sleep. However, that does rely on you being able to fall back asleep into that deep sleep where you're getting the REM cycle and you're getting that deep regenerative sleep. So yes, 7 hours in a 24-hour period of quality sleep is better than 5 hours. And it can be broken up if you're actually able to get back into that deep sleep cycle.
Another online question. I've read that 10 milligrams of melatonin is the maximum dosage, yet some suppliers provide 20 milligram tablets. How do you know if you've taken too much?
Fantastic question. That's wonderful. So with supplements, vitamins, melatonin, they're not actually FDA regulated. I always say read the labels for food and for vitamins. So yes, manufacturers can make a 20 milligram melatonin tablet. You can take 5 or 6 of those tablets. However, when we talk about the maximum dosage of 10 milligrams, look at 2, 3, 5, and 10 milligrams, that's based on research. That's based on studies and the effectiveness of that supplement for the desired result. And we saw that at 10 milligrams, you are able to get the desired result, better sleep. But over 10 milligrams, you don't see any change. So taking 15 milligrams, taking 20 milligrams, there isn't a one-to-one correlation with a higher dose and better sleep. So when we talk about that maximum dose, it's not that you're going to overdose on melatonin. It's just not going to help if you're taking large doses like 20, 30, 40 milligrams. 10 milligrams is the largest studied dose that showed that effectiveness really without any other concerns then.
I had a question about that new device called Inspire.
Yes.
Is that actually an implant that they put in your throat?
Yes, so it is an implant. It's about the size of, I was going to say $50. And it's implanted sort of in the, from my understanding, the hard, sort of the back of the throat. So it's not something that you can see, something that is put in the OR, almost like a pacemaker is placed under the skin.
Do they do an incision or go down through your throat?
So they do a incision. Mm-hmm. And it is implanted, and there's a device that you use to sort of turn it on and off. It's similar to implants that are used with deep brain stimulation for control of seizures, as well as some devices, some implants that are used for the heart.
I have found that a low noise, like classical music or low key talk helps me, And does that relate in any way to a white noise generator?
Yes, so classical music, like kind of low noise, the white noise generators. So there are studies looking at the brain waves. I didn't talk as much about the different types of brain waves during those sleep stages, those cycles of sleep, but the brain waves and some frequencies of sounds, such as classical music, white noise, has been shown to promote some of that sort of restfulness of the mind. Now, whether there's a particular sonata or a particular perfect frequency for that white noise, I really haven't seen any research saying this is the one, this is what you should play to fall asleep every night, but that can be helpful. And the idea with the white noise is to, the white noise machines, for example, is to really sort of help tone out some of that background, maybe the dogs barking or the traffic or those other kinds of high alert sounds that can help you go through that first and second stage, the non-REM sleep, to get into that deeper sleep.
Well, how late is a good time to have a meal? You said don't have a big meal late, and I tend to eat fairly late.
So at least an hour between eating and going to bed, preferably 2 to 3 hours. You know, that's not always feasible. Sometimes you get home late and you just need to have something before you go to bed. But ideally, at least 60 minutes, if not 2 to 3 hours before bedtime, whatever time that is.
And I have a second question.
Yeah.
About, I have a habit since I retired of having a nap after lunch. It used to be 10 or 15 minutes. Now it's kind of crept up to about 40, 45 minutes. Does that hurt or help?
It hurts if it's preventing you from getting your full night's rest later on. It is helpful though to have that quick regeneration. That nap in the afternoon is great. There are lots of studies that show that those 15 to 30, 40-minute naps actually are very helpful for giving your brain a quick energy boost. So yes, it's helpful as long as it's not impacting your full night's rest later on.
Thank you.
So I like the National Sleep Foundation. It's nonprofit. They look at research from all over. So this is mainly the United States, but Johns Hopkins, they do also pull on information from the UK and other studies, and they pull this together in a way that is helpful for day-to-day life. Thank you. Great. Thank you. Thank you, everyone. I hope everyone learned something. Oh, well, sorry. Oh, thank you. Thank you.